Okay, so this is part 2 of nutrients, chapter 30. So we're going to pick up where we left off and let's talk about vitamins. So vitamins they consist of carbon, oxygen, hydrogen, and sometimes nitrogen, other elements. They are organic substances. One of the important things to know about vitamins, they can be lost or diminished during certain food storage temperatures, especially cooking at high temperatures. You can sometimes boil the vitamins right out of some foods. So that's important to know. Food is your best source of vitamins. There are supplements available, but you're always better off getting what you need from the food that you eat. And vitamins are different in solubility, how they're absorbed, how they're transported, how they're stored, and how you excrete them. So there are two basic types: fat-soluble, which is A, D, E, and K, and the water-solubles, which are the C and all the B complexes. Okay, and you need to know that. Okay, so let's start at the beginning. Fat-soluble vitamins, vitamin A, also known as retinol or beta-carotene. This one is big for your eyes and your skin, okay? It helps with the growth and development of bones and teeth too, but the big thing is eyes and skin, okay? So remember that for vitamin A. If you don't have enough vitamin A, you can be night blind. Just lots of problems with vision and lots of problems with skin. So you want to make sure that you're getting enough vitamin A. Carrots, Bugs Bunny used to eat his carrots, right? Toxicity, which is not common, but if you have too much vitamin A, because again, it's a fat soluble and it can be stored, you can have headaches, vomiting, double vision, loss of hair, liver damage, and it can also cause birth defects to the fetus during pregnancy. So too much of something is just as bad as not enough. Next fat soluble vitamin, vitamin D, also called calciferol. One of the biggest jobs of vitamin D is to maintain enough calcium in your blood. Okay, that's the big thing with vitamin D. Deficiency causes lots of problems with bones and teeth. Very important to have enough vitamin D also because it affects your calcium levels. And toxicity can give you kidney stones, kidney damage. It can even kill you. Again, fat-soluble vitamins, too much of them is very dangerous. Our next fat-soluble vitamin is vitamin E, alpha tocopherol. The big thing with vitamin E, it's an antioxidant, protects some of the other vitamins. Very strange to be deficient in vitamin E, and also it's pretty non-toxic of all the vitamins, but it can build up in your arteries like atherosclerotic plaque. So you want to be careful with vitamin E. Vitamin K, metadione. Vitamin K is important as a synthesis of all the clotting proteins that your body has, the things in your blood that help your blood give it the ability to clot. So if you have a deficiency of vitamin K, you can bleed out, you can hemorrhage. Not aware of any toxic symptoms with vitamin K, but vitamin K, you should know this, is the antidote to an anticoagulant drug called warfarin. It's going to make more sense down the line, but again, because it has to do with the blood's ability to clot. Warfarin's an anticoagulant, so it slows the blood clotting. Vitamin K is the antidote to that. Now, your water-soluble vitamins, vitamin C, also known as ascorbic acid, big for your skin, big as an antioxidant for your immune system, and it also promotes your absorption of iron. So if you're taking an iron supplement, you should take it with some orange juice or some grapefruit juice because the vitamin C will actually help you absorb it, okay? Now, the B vitamins, B1, which is thiamine, big with nervous system function, okay? The water-soluble vitamins, it's very rare to become toxic because your body will excrete them if you have too much because they're water-soluble, unlike the fat-soluble. Your next one is vitamin B2, which is also called riboflavin. And it's a big one about energy metabolism, right? Giving you energy. So you should know that. Don't worry about the deficiencies. Toxicity is unlikely because it's water soluble. B3 is niacin. Niacin promotes nervous system function. Very important. You can take too much of this one, even though it's water soluble. If you take too many supplements, it can actually cause liver damage or ulcers. Okay. Next one is pyridoxine, which is vitamin B6. Vitamin B6 helps your pancreas produce insulin. And it's also one of the important vitamins in hemoglobin, right? Again, the nervous system, because it has to do with the myelin sheath, which is the kind of a protective covering around your nerve cells. So B6 has to do with producing insulin and protecting your nerves. B9, folate or folic acid, big one for pregnancy. Baby's nervous system formation. So if you're thinking of becoming pregnant, it's a good idea to take a folic acid supplement, some folate, but also, get it in your diet. It's important to get things in your diet rather than supplements. Cobalamin, vitamin B12. So B12 is big for synthesis of new cells in your body. B12 activates folic acid, and B12 maintains your nerve cells. Deficiency of vitamin B12 is called pernicious anemia. It can cause glossitis, which is a swollen and irritated tongue, and severe neurological changes like confusion, disorientation, that type of thing, even neurological problems like gait abnormalities. Okay, so know your vitamin B12. Okay. There's some other, water-soluble vitamins, pantothenic acid, which is part of a coenzyme of another vitamin. It's used for energy metabolism, but I'm not going to worry too much about that one. Biotin is also a coenzyme. Wouldn't worry about that. Quick question, which vitamin is also referred to as ascorbic acid? If you said vitamin C, you would be right? And there are the other names for the other vitamins also. Then we have prebiotics and probiotics. Prebiotics, don't worry too much about that, but they're things that are kind of like fiber. They're not digestible, and they feed certain good bacteria that you have in your gut. We all have good and bad bacteria in our gut, and prebiotics can help feed the good bacteria to keep things in check. Probiotics are actually live bacteria, but good ones. Two examples would be acidophilus and lactobacillus. You can get them in yogurt. If you ever look at a container of yogurt, if it says live cultures on the side, that means that it's probably got acidophilus and lactobacillus in it. Probiotics are great if you're taking an antibiotic that's a broad spectrum, because what can happen is it can kill all bacteria, good and bad, and you can wind up with candidiasis, it's oral thrush. It's like a super infection. It's a fungus. Or women can develop a yeast infection, which is Candida albicans, candidiasis, because of having the good bacteria being killed off in as much as the bad bacteria is being killed off. So it's a good idea, if you're on an antibiotic, to either eat yogurt, or you can even buy these probiotics over the counter to help. Okay. You don't need to take them unless you're on an antibiotic. Lots of research recently has come out to support that. Eat a healthy diet, right? A healthy diet means that you've got variety, moderation, and balance. They are the three important parts of a healthy diet. You want to have a little bit of everything. You want to eat in moderation. Stay away from all you can eat buffets, because they are just not a good idea. Nutrition labels. So the government requires that all foods have nutrition labels on them, and they have to give you certain information. So they have to tell you what the serving size is, So you may have a container, say a bag of chips. A serving size for chips may be like 10 chips or 15 chips, but do you really only eat 10 or 15? Right? So it's important that we understand labels and we understand how to read them. Should give you the calories. It'll give you a list of ingredients, and the ingredients are listed in the order in which they are in volume in that product. So in other words, if it's mostly sugar, sugar will be first. Okay. So, be aware of different names for things that are kind of the same. So, good example, sugar. Sugar has all these names: beet sugar, brown sugar, cane sugar, confectioner's sugar, corn sweetener, corn syrup, dextrose, fructose. List goes on and on. They're still sugar. They just have a different name. So you have to be aware that sometimes it's a little tricky. And be also aware if similar ingredients are listed, like if they're different types of sugar, then there's a whole lot of sugar in there. Okay. Nutritional problems. Usually nutritional problems come from either overconsumption or imbalance. And, heart disease, certain types of cancer, stroke, diabetes, all of these things are directly related to diet. And overnutrition, eating too much, contributes to high blood pressure, osteoporosis, cavities, GI diseases, and obesity, right? If you are eating a lot of calories, fat, cholesterol, salt, sodium, salt, and you are eating the simple carbs, not the complex carbs, these people that eat these types of diets have high rates of these chronic disease processes. You are what you eat. When we assess patients, it's important to assess their body weight. What we use is a body mass index measurement, takes the patient's weight in kilograms divided by the height in meters squared. But it doesn't take into account your build, right? Or say somebody with, more bone density or somebody who's very muscular. But as a general rule, anybody who's got a BMI of 30 or higher is considered obese. Over 40 is considered morbid obesity. When you see morbid, that means that it can cause really bad problems. In this country, we have an epidemic of obesity. To be overweight means to be about 10 to 20% over your ideal weight. Morbid obesity is 20% or greater than your ideal weight. And obesity just means there's excessive amounts of fat on the body. And what we're finding now is children and adolescents, their rates of obesity are climbing exponentially. And that's concerning because that's setting kind of a standard for where they're going in their life. So it's lifetime of complications and chronic diseases. There can be malnutrition, right? Which is just as bad, undernutrition, just as bad as overnutrition. People can have inadequate food intakes. They might have eating disorders. They might have problems with their GI system. All these things can lead to malnutrition. There's protein calorie malnutrition. There's marasmus, kwashiorkor, just different names for different types of malnutrition states. But, the bottom line is too much or too little, no good, right? When you're pregnant, you need a good intake of protein, iron, calcium, vitamin D, and folate, right? Because of the baby's neurological system. Your calories need to be increased only about by 300 a day and only during the second and third trimester. Weight gain is typically recommended to be between 25 and 35 pounds. And I'm going to put that in here. Weight gain, 25 to 35 pounds. If there's a family history of diabetes, that increases the risk for gestational diabetes. So women will be screened for that usually second trimester. If they do have gestational diabetes, there's a very good possibility they may develop type 2 diabetes down the line. So that's something important to be on the lookout for. Infants. The amount of growth that happens to a baby in the first year of life is incredible, okay? Babies, when they're newborn, should be fed on demand. And when they cry, they want to eat, feed them. Don't start solids until they're about 6 months old. If you're introducing a new food, only introduce one food item at a time and do that for a few days. So this way, if there's any kind of a reaction, you know which food is the culprit. And no whole milk and no honey until the child is over 1 year old. Okay. Very important. Honey can cause botulism. Kids, childhood eating habits. Sometimes kids are finicky and picky. Sometimes they'll go through phases where they'll only want to eat one thing. It's important that kids start to develop good eating habits when they're little. It's going to set the tone for the rest of their life. when I was a kid, finish everything on your plate. Don't do that. I mean, that's not good. Stop eating when you're not hungry anymore, right? Stay away from fast food, junk food, right? Those things usually have very few nutritional values and lots of empty calories. Adolescents, again, growing quickly, need lots of food, nutritious snacks. It's a good idea for people to eat small, frequent meals. Everybody, right? Your body and your metabolism do better when they have a steady flow of food intake as opposed to 3 big meals a day. Um, that sometimes teenagers especially can get finicky or they're too busy to eat or whatever, or girls are worried about their weight. You want to make sure that, good, healthy eating habits are developed at these ages. Young adulthood, muscle and bone mass starts to decline and the proportion of fat can increase. So if you're not moving around if you're not moving around, you need to decrease the amount of calories you're taking in, because if you don't, you're going to become overweight. And it's real easy to gain weight, but it's really difficult to lose weight. Okay. So that's important. Older adults, aging, people that have had bad eating habits their whole life already are usually paying the price for that with degenerative disorders like diabetes and osteoporosis, hypertension, atherosclerosis. Um, Older folks are at even higher risk for nutritional problems because of things like difficulty chewing, dentures that don't fit properly, changes in taste and smell, isolation, impaired mobility, depression, polypharmacy, lots of medications, constipation, decreased thirst, lots of different risk factors for older folks and them having nutritional problems. People over 50 sometimes need vitamin D because we all have something called intrinsic factor in our stomach. And that amount of intrinsic factor decreases as we get older. We need intrinsic factor in order to absorb vitamin B12 from the foods that we eat. Adults usually get enough calories, if not too many, but they can still be deficient in specific things like calcium, K, fiber, mag, etc. Kids usually have an insufficient intake of fiber, mag, vitamin E. Pregnant women need iron, right? They need folate, and especially in the first trimester or even before you get pregnant is even better, right? We have something in our skin that actually helps us make our own vitamin D. Okay. So you need 15 minutes of sunshine a day to activate that in your skin to actually have vitamin D. Older folks, or if you have really dark skin, you may need to get some extra vitamin D in your diet. Right. And older folks should try to have diets that are low in fat, especially the saturated and trans fats. And taste buds, as we get older, taste buds start to kind of fail a little bit. And so things don't taste as zesty as they did before. So sometimes you'll see older folks pouring on salt and sugar. Not good. Not a good idea. Increases their risk for hypertension, diabetes, etc., and weight gain. Gaining too much weight, bad for your frame, for your bones, right? Makes it difficult to walk. Mobility gets decreased. They gain more weight. See how that's a vicious cycle? And that's something that, needs to be considered. Here's the question. Is the following statement true or false? The nurse should provide education to each client to ensure proper nutrition is achieved to help prevent chronic conditions. Of course, that's a yes. That's true, right? Try to practice good eating habits. You are what you eat. All right. That's it for chapter 30. Hope you enjoyed it and talk to you later. See ya.